Okay. Dr. Karim Daka. Okay, so we are now going to start. This is the second part of the same clinic. We are starting now to talk about adult treatment, and we will start with the anesthesiologist, Dr. Dakak.
Perfect.
Hi, how are you? You're more than welcome to open your camera, doctor, if it's possible for you.
Let's see.
After your lectures, we will discuss a little bit about questions that came up from the previous lecture, and we'll continue. So the floor is yours, doctor, if you want to start.
Yeah, I would just wait for the questions. So.
Okay, so I will ask you the questions that were asked for you. Is that what you are interested to do?
Yes.
Okay. So a lot of patients asked about the safety regarding doing stem cells via intrathecal. We understand that you make this procedure, do this procedure from 1 year old. Here in Israel, it's not orthodox to do this kind of procedure at all. And a lot of
same here.
Same you, I know. So I want you to explain why would you do this kind of procedure to a child? And what is the purpose of this procedure for a child or for an adult, so our patients will understand why is it being done like this?
This question is more to Renata. Why is it done? The question for me is how is it done and the problems with it. So is it done normally as any spinal injection? So we put needle into the back and to get into the CSF, which is cerebrospinal fluid. As soon as we get there, we put the injection, which is prepared by Renata, and inject it. So it's basically the same as any spinal procedure we do. Instead of local anesthetic, we give stem cells. That's the only difference.
Okay, can you give our patients some warning signs or guidelines of what they should do or not do, or signs with small children of problems that can rise up from this procedure? Because I think this is what they are worried about, that something will go wrong and they will not be able to identify it.
There is a lot of things which is written in the literature, so I can have a lecture maybe later for a couple of hours, what it can do or doesn't. Basically, there are immediate and late problems. Immediate problems is it during the injection, which could be anything from infection, bleeding, and so on. Nerve injury, of course. And the late things would be something like post-dural headache, which is the very commonest we have, is about 1 to 10% in every patient. But is a headache, so basically after a couple of drinks of caffeine and fluid, it basically is eased off and dismissed quite soon, usually within the week. So it's a benign problem, and quite often we can get this one. The other problems which I'm talking about is more serious, and that's the reason we need to do it in theater in very sterile conditions to prevent any infection, and any bleeding problems are checked by clotting machines and make sure that the patients are not any anticoagulant treatment, so they wouldn't bleed, because bleeding outside is all right. Problem is bleeding inside.
What age would you recommend patients to start doing intrathecal?
This is for Renata, not for me.
Okay, I promise I will ask Dr. Renata, no problem. Anything else you can explain about anesthesiology that you think is important for our patients to know?
The most important thing is they have to be quite still, because if they are jumping, I wouldn't be able to do it, because it's very precise procedure. And if the children is small, then every millimeter or tenth of inch, let's say, does matter. So.
Okay, do you anesthetize children, especially the young children or the autistic children before?
Yes.
Can you explain about the different medications?
Sometimes
you can also explain about the different medications you use.
Sedation, nothing else.
Okay, so just easy sedation.
We can't give
like
any anesthesia.
So
we cannot give any anesthesia because we will. Yes. Maybe the signal is lost because I'm in a train. But as I said, we can't give any anesthesia or any deep sedation because we will kill the stem cells which we are giving. So that's the reason we just give a light sedation. That's maximum we can give.
Okay, so maybe some dormicum.
Yes, that's we give. We call it midazolam.
Midazolam, same material. No problem.
Yes, indeed.
Okay. Anybody has a question about anesthesiology before we let the doctor go? He's on his way to a conference. Okay, thank you very much, doctor. We will continue with Dr. Renata and Dr. Victor. Have a good conference.
Perfect. Thank you very much. If anything, Renata is very capable to answering many questions. She knows all the processes. So if there is any questions, just write me in text,
we will make sure.
I can come back and join you in this Zoom meeting.
Thank you very much. Enjoy your meeting. Bye bye.
Thank you. Cheers. Bye bye.
Dr. Renata, the floor is yours. I want to start talking about the lectures from last week. First of all, we had a question from the patients at home. They asked for you to explain again the different ways you calculate stem cells given through an IV. We understood as a group that you only use stem cells from cord blood to give through an IV. They did not understand how you calculate the amount of cord blood units that you are giving. It wasn't clear. Can you repeat and explain this part?
Yeah, we are using two different sources for the allogenic. It's cord blood and cord tissue, or Wharton jelly, if you want. And the other part is autologous from the fat what we have, or the autologous if the patient has storage the own cells. So for the allogenic, for the source cord blood, we can put together some source. This is maybe not understand you because the cord blood, it's only one bag and you have some count of the cells in one bag. But if you want to have the bigger count of cells, we need to put together 2, 3, 4, 5 bags with big volume of the cells. And this is the same for the cord tissue because we cannot culture.
Okay, so for cord tissue, because of the law in Europe, you are not allowed to culture. So whatever you extract on your first extraction, this is the unit for this cord. And if
Yes.
we need a bigger unit, we just joined a few different units together.
Yeah.
And how do you make the matching?
Because we are not have the full bags and full tissue. We are, if we have the source, we isolate the mesenchymal stem cells, and this we put together.
Okay, so we would like today to discuss adults. We were given questions about a few different conditions. I think the most popular question, which is something that your clinic does that's very special, is diabetes. It's the most common condition amongst adults everywhere. We were asked questions about type 1 and about type 2. So I would like you to explain a little bit about both kinds of diabetes, what the protocol would look like for adults, what it would look like for small children, and what you think should be done with these patients, including the complications that are known for diabetes, because this is the most common questions we receive right now.
Yes, for the diabetic ones and diabetic 2, we do it the treatment. Especially we are doing the diabetes one for the children, the young children. It's only intravenously application. And for diabetes 2, we are doing intravenously, and for the diabetic ones, because some of the people with diabetes 2 has some problems with ischemic roots and some problems with the food. So we are doing locally, muscular injection and intravenously.
So you have a triple protocol for the same patient, IV,
Yeah.
IM, and local injections
Yeah.
to diabetic feet only, or even if there's no diabetic problems within the feet?
Diabetic feet in the like chronic ones opened before the amputation. We have a lot of people who is doing this before the amputation of the foot. So, and we do 2-3 years ago the big clinical trials for these people.
Can you tell us a little bit about your clinical trial with this area?
We can send you all photo. It was like 60 people, 60 patients with these problems, and 85%, 86% people don't have amputation. So with stem cell, we are doing the treatment IV and locally and intramuscular, and they save the foot. So it was very nice result.
I want to ask you about neurological diseases before we continue to orthopedics. So we know that trials are being done with multiple sclerosis and with Parkinson's. What do you do in your clinic?
We are doing sclerosis multiplex. We are doing Parkinson, amyotrophic lateral sclerosis, some of the autoimmune diseases compared with neurological, because some of compare autoimmune and neurological. And for the neurological, it's like spine injury or stroke and something like this too.
Can you explain more about stroke and heart diseases?
About heart and stroke, we are doing intrathecally and intravenously, because some of the people has the problem not only on the body, but neurological. So we combine it for this, for the adult, intrathecally and intravenously injection.
What do you see with these patients?
I sent the line for our webpage. It's now only on the Slovak, but next week will be in the English, and you will find some success story about these people. It's two different, very nice story. One of the Mr. Miroslav and Mr. Attila, he has stroke, and there's another one again stroke with some heart problems. They can't walk, they can't speak, they cannot only, the doctor say they will be only on the coma for every time in the lying in the bed and nothing to do. But these two guys is around 60 years old and now is walking, can speak, can do everything at home, normally live. They don't do to the job, but can normally live. So.
Okay,
you can
and how
find
many
also the YouTube.
treatments did you do for these patients?
Mr. Attila has 3 and Mr. Miroslav 2. One was from the granddaughter and one from the allergenic.
Okay, so they were given, some of the units are given from grandchildren, grandparents.
Yeah.
Okay, can you tell us a little bit more about moving cord blood from grandchild to grandparents? Because in the audience, I can count at least 3 grandparents that are present here. And I think they would like to have some information how you transfer cord blood from grandchild to grandparent.
We agree with the hospital and with the mother from the baby. And we prepare also back everything for the to do the cord blood and cord tissue. When we receive, we isolate everything and prepare for the grandparents or from family. So it's from the first step is our. Okay. So we are not waiting for the hospital how to do, but we are doing everything.
They need to do any tests before they come?
Yes, we are doing with the mother, with the baby. The hospital do everything for us. And after when we receive, do it again because need to do the control.
So I need to send you a matching test before, HLA test before.
Yeah.
Okay. I know you also treat diseases like epilepsy. Can you explain a little bit about it?
For the epilepsy, it's especially for the children with cerebral palsy or some like autism or ADHD. And this is if the children cooperate, we can do the intrathecally and intravenously. If we see the children, it's not cooperate and more hyperactive, we are doing only intravenously. We have very good result with the children only for the intravenously too. Some of child has like 9 to 10 epilepsy attack in the month, and now only one in the 3 months or less. So it's very nice result for the children and could be only intravenously.
How many times would you recommend to do this kind of treatment for these children?
If it's only epilepsy attack and like cerebral palsy, they can 3, maximum 4 times.
Okay. And
it's
do
between 10 to 12 weeks. 10 to 12 weeks.
So you can
the
do
period
it
between
10 to 12 weeks. That's not too short, like 3 months period. That's enough.
Yeah.
Because usually they recommend at least 6 months.
Yes, it's maximum the 6 months. It's about the traveling, financial situation, everything. Because if we use only one on the 1 year, we start again, and nothing to do. So 6 months is maximum when we recommend for the people. If you can come to repeat the therapy, it's better to come early.
Okay. I'd like to speak a little bit about autoimmune diseases, like maybe Crohn condition. I know you treat some Crohn condition. What other autoimmune diseases do you treat?
For the autoimmune, we have very good results with some people from sclerosis multiplex for the progressive grade 1. If they use some biologic treatment and combine it with this, we have very good result. They can normally work. We have some nurse from USA who is doing 2 times the treatment and now is normally working in the hospital without any problems, can walk and everything do it. So it's very nice. But if they comes very later, the result is not so okay. So especially for all diseases, you need to come early when you have the diagnosis and start the treatment.
And what kind of autoimmune diseases do you treat other than this?
Sclerosis multiplex, ulcerative colitis, Crohn diseases, rheumatic arthritis. This is what we treat.
Okay.
With this, we have good results and more patient.
Okay. I want to talk a little bit about orthopedics. I know you do treat some orthopedic problems. Can you explain a little about it?
We start on the 2015 with the orthopedic diseases. It was for the joint local application, and we continue still. Every week we have more than 4 or 5 patients for the local injection for the joints. It's not only knee or hip, it could be shoulder or something like this. We are not doing the spine injection. It's very risky and the people is flying back home, and this is very small volume what we can do. So the doctors don't want to do this. So if some asking for the spine injection, we are not doing this.
So
normally
maybe
the joint,
big joints like hip,
yeah,
shoulder, elbow, knees,
ankle, everything.
Ankle, things like this. So traumatic injuries or just wear and tear of cartilage?
It's like cartilage or traumatic or after some accident. It could be like for after arthroscopy in orthopedic surgery because they had some problems for the regeneration. So we could do after this operation again the stem cell therapy to help to be better, and the reconvalescence will be earlier. So and for this we can use also autologous or allogenic. For autologous from small liposuction, it's like 1 day surgery and the people is coming around 8 o'clock at morning. We are doing small liposuction. After the people waiting in the room to preparing the stem cell, and around the lunch we are inject the own stem cell from the fat. So this is the one way, or if they don't have fat, we can do the allogenic treatment.
I think that our Israeli crowd will have enough fat for your procedure.
Sometimes no.
I'm pretty sure. If not, I'm willing to come for liposuction. I will donate it. No problem. Any other areas that we didn't speak about in the previous meeting that you would like to mention that we didn't talk about yet? Because this is a good chance for our audience to know what you are doing.
I think we are talking about the autologous, about allogenic, about the source, how we could do. I think, yes.
Okay, joining us now, a patient with diabetes that wasn't here before. If you can explain again about the different protocols that has to do with diabetes, type 1 and type 2, and what are the results that you saw before? I think our patient here will really appreciate it.
Okay, so we are doing for the diabetes 1, the intravenously injection with the allogenic or autologous if they has own in the storage. And for the diabetes 2, we are doing intravenously combination with intramuscular or locally to the foot chronic wounds if they have some problems, open chronic inflammation on the foot.
Can you explain about the results you see with diabetic patients?
Change the liver function, the pancreas function for the first and the 2 diabetes types. And for the wounds, they close the chronic wounds or the inflammation is very less. We can send you some picture about before and after.
And does patients that are treated with insulin, so they're insulin dependent diabetic, can they, after this kind of treatment, go off of insulin and have a life with no insulin?
We don't have any patient with no insulin, but use only small volume of the insulin, small concentration. Don't need like insulin pumps, change from insulin pump for the only injection or like this.
Okay. And how many treatment does a diabetic patient need to have? What kind of protocol is expected for them?
We have 2 or 3 applications. If they has locally, it could be 2 times the locally injection and 1 intravenously.
I think that at this point, I will allow the patients to ask questions if they have, and if they don't have, we will say goodbye and I will send you questions afterwards. מישהו רוצה לשאול שאלות?
כן, אני אשמח אם אפשר.
את רוצה באנגלית או שאני אתרגם אותך?
אני יכולה באנגלית, אין שום בעיה. תודה רבה. Hello, nice to meet you. My name is Angelica. I wanted to ask if you have any experience with Behçet syndrome. No. Okay, and about arthritis, if you have experience with arthritis and how many units you need to treat it, if you need only blood or also tissue.
I don't heard the diseases. Can you repeat me what you asked?
Behçet syndrome. Behçet syndrome.
We don't have any patient from this syndrome, so any experience, I need to say you.
And about arthritis?
About the arthritis is the local injection to the knee, hips, or some other joints. We are doing every week this from gradus 1 to gradus 3, 4, because if you have 4 gradus, it's for the changing the joints. So we do the 4 gradus arthritis only for the people who is contraindication for the surgery, like with cardiostimulator or something like this, and don't or can't have the surgery. So we are doing only in this time. From normally 1 to 3 to 4 gradus, you could do the arthritis application with your own or with allogenic stem cells.
Okay, it's only stem cells. I mean only blood, not tissue, or also blood and tissue.
It's from the blood.
From the blood. Okay, yeah. Great. Thank you.
The mesenchymal stem cells from the blood.
Thank you.
Bye.
I also have a question. You spoke before about orthopedics. I'm actually Shira's daughter, a mother. She's my daughter. I've got, I broke my ankle twice, and it's once 30 years ago and once 3 years ago. I'm 63, and I still get swelling on the joint where the bone was broken, and pain. Could you actually do anything to help with that?
Yes, could be. It could be with the mesenchymal stem cells, so, and help to regenerate the broken and also the other. Because it could be local and intravenously injection to help regenerate the bone marrow and also the bone on the body.
That's also, you know, after you break a leg, one leg is longer than the other, slightly longer. Would that also help even things out, or help with my other leg that is, you know, it's become the stronger leg?
We need to see the MRI if you have some recommendation from orthopedic and traumatic doctor about what was broken, did it be missing, I don't know, calcium or vitamin D or something like this. And it helped to understand what is the problem for the broken.
I will help her assemble a medical file to send to you.
Yeah, yeah. It's better for the understanding what is the problem, healthy problem. Today we had some young girl with broken legs and not regenerate after the surgery, and she received intravenously injection for regenerating and broken legs. Missing calcium.
This treatment could also help a young man who also broke his leg quite badly and is having very difficult time walking again.
His bone isn't recuperating, and he has XFix. You know what XFix is? XFix is external fixation. I have a family member, a young man, he's about 20. He had a very bad motorcycle accident, and they cannot fix his bone internally. It's his ankle. So they've done external fixation, and he's not healing properly. The area is very inflamed, and right now the bone isn't joining together. And I think that for him, stem cells can really help, because even if it will reduce inflammation and the bone can grow after this, it might be a solution for him. He's been like this for 6 months. It's a very long time. And I'm afraid that the bone quality is not very good now.
But we need more information. MRI, very helpful.
I know. I will explain the parents the condition, and if they are going to be willing, I will send a medical file for them.
Yeah.
Anybody else wants to ask a question? This is a good time.
Yes, I would like to ask something regarding what you said before for treatment for people after a stroke or after orthopedic injuries. How long from the actual stroke or injury is it possible to give a treatment that will actually make some difference?
I don't know, say it could be 1, 2, 3 weeks or months. When the patient is on the normal situation and can travel or can come to the hospital very early, it's better. If you use long time and come after 1-2 years after this, the result will be again very long time. So you need more rehabilitation, everything. So if the patient is normally and can come for the treatments, it's better to come very early. The result is very nice.
I'm actually asking, it's Sarah again, Shira's mother. I'm actually asking for two friends. One who's had Parkinson for 3 years, and another friend who's just started with tremors. What would your advice be to them?
For the Parkinson, we have some patient and they had 2 or 3 times the treatment and reduce the attacks, the tremor, and the motoric skills is very nice.
So what do they do? Would they need to go through Shira to prepare the file and to send you? What will they need to send you?
Yeah.
Okay, so I'll talk to Shira what they'll need to send you. The one thing that they both have asked is, and Shira hasn't mentioned it and you haven't, can you give us like a ballpark how much a treatment would probably cost?
Yes, of course, we could do.
I think that for these patients, once you see the medical file, you'll be able to give a financial estimation to how much it will cost, because I think it's custom made.
The first step every time is when we have the medical record and the patient questionnaire, we recommend for the patient what we want to do for him, how much is cost and how we are doing. So everything we are consult together. So
thank you. I'll pass the information on to them. The English isn't that good, so I'll translate what you've said. Okay, thank you.
Can I ask another question?
Yes, of course.
About arthritis, I just wanted to ask, this disease, it's like appears every time in another place. It can be on foot or knee. My question is if stem cells therapy can treat it completely, or it's just like local help?
For the arthritis, it's locally because we are doing locally to the knee, to the shoulder or the hip or some ankle. If you have the problems, arthritis, it's locally injection. It's not going to the full body, it's only locally.
Okay.
And they treat the locally arthritis. So some patient which is coming for the treatment and they has 2 or 3 gradus arthritis, they need to repeat after 2 or 3 years, or if they active sportsmen coming every year, but it's different patient by patient.
Okay, thank you. Thank you very much.
Thanks.
Hi, Renata.
Hi.
Monica, we can't hear you.
Okay, can you hear me now, guys?
Yeah.
Okay, so nice to meet you. My name is Monica. Talking about the autoimmune disease type 1 diabetes among children. And I wanted to know, so how long does children with diabetes, how long do they have diabetes before they usually come to you? In my case, for example, we are 6 years into the diabetes. It was diagnosed when he was 2 years old. He's now 8 years old. So does the 6 years has any effect on the treatment?
We had some guys, some children who is 10, 12 years ago, and they has the treatments now. So they was diagnosed 10, 12 years ago, and now they receive 1-2 times. So I don't know to say because it's very early for us to.
Okay, and another question. Sure, definitely I will follow up on these cases. It sounds extremely interesting. Another question is, does the stem cells has any effect on the beta cells on the pancreas, or does it affect the immune system?
The pancreas and the immune system too, because it's applied intravenously, so for the whole body and with big amount of cells, so from all the body.
What makes it being less than a temporary effect? I mean, can it be something long-lasting effect? Because as we know in the chronic disease, the immune system attacks the pancreas, attacks the beta cells, and definitely, take them out of any production of insulin. So will it be temporary, or can we expect a long-term result?
The long-term result.
Mm-hmm. Okay, thank you. And I'll definitely track the specific case studies that you just mentioned. Thanks.
Yeah,
Monica, please talk to me afterwards so I can help you reach more research in the matter, because now we know we have a lot of patients in this condition, and I want to see maybe we can find you more answers.
Thanks. I will.
Anybody else? This is the time. So if there are no more questions, we will say thank you very much. Dr. Victor, is there anything else you would like to add? Maybe something we did not discuss?
Yeah, hi everybody. I'm a little bit sick today, so it's very hard for me to speak. So I was only listening, and I'm here with all. I can only say it's never too late to try this treatment, because it's very individual, and yeah, always it's better to come early, but never is late. So don't be afraid. Try it maybe once, maybe twice, and maybe when somebody from Israel came to our I'm sorry, to our facility, our hospital, and then we'll share own experience. It will be absolutely perfect for everybody, because it will be an experience with first hand. So we are very happy from this discussion and consulting, and we thanks for the space and the area for presentation of our company, and we are prepared for cooperation. So I hope we will see somebody from this group, or maybe this 1 week ago, and we try always do our best. So don't be afraid.
Thank you. We have another question about type 1 diabetes. I knew there would be a lot because this is very common. The patient would like you to explain again about the protocol and what is expected for a patient like this. So what will happen once they arrive to the clinic, and what you think will be a good result for this patient? We're talking mainly about adults that are using insulin for a very long time. These can be people in their 40s and 50s that are sick from childhood.
Yeah, we could send you the protocol step by step, what we are doing from the first for these people, and some picture before and after for the local injection, and some result about the patient for this, for the adults especially. I think it's better to using. So the first step when you are come from another country to other clinic, we start with administration for the blood draw for the patient. We are using for the injection the own plasma for the patient. So the blood draw means taking the blood, the plasma, preparing the fresh cells. For the diabetics, we use from the cord blood, mesenchymal stem cells, and also the hematopoietic cells, because this regenerate the liver and the all function in the body. And also for the local injection is better to use also for the inflammation, the hematopoietic cells and the mesenchymal cells combination. So when we have the cells prepared for the infusion, the people receive the intravenously in the room, and after going to the operating theater, and we inject around all feet or some chronic ones, a local injection.
If you have like blood vessel problems, but no wound yet, so no diabetic foot, but you can see that there are vascular problems around
it's like ischemic one.
So you inject around those vessels that are looking damaged locally. So you would inject a few different areas. This is important information because we spoke about diabetic foot, but most of the diabetic patients are just starting with vascular disease.
Vascular problems, yes.
And can this
sometimes a little bit painful, but we use some lidocaine crema, like for the cauldron, like anesthesia cauldron, and we inject close to the foot. So it's
so
like
I can also use this for general vascular diseases. So if I could see somebody who's starting to have vascular problems that are not diabetic problems, just vascular.
No, it's vascular,
So I can use that for like an adult who's starting a vascular disease or maybe some spasm in the feet that are not affected. And I can do local anesthetic and local injections in this canal. So this is
it's around the 40 injection in the foot.
Okay, and it will also be cord blood. Okay, good to know, thank you. עוד שאלות, מישהו? אפשר גם בעברית ואני אתרגם. Okay, I think we don't have any more questions for tonight. If anything else will come up, I will write to you and we will arrange for an answer. Thank you very much, doctors. It was a pleasure to have you. It's very important to talk not only about children, but about adults too. And hopefully we will see a lot of patients that come and receive treatment in your clinic. Have a very good night. And in behalf of the Israeli crowd, thank you for dedicating your time to us. Good night.
Thank you too. Have a nice night.
Thanks for your time and the meeting. Goodbye.
Bye.
Bye-bye. גיא, תרים לי טלפון, תיקח מאבא שלי את הטלפון, אני אענה לך. בסדר?